Imagine two drivers. Let's call them Anna and Billy. And they're both driving identical cars, but they have very different driving styles. Anna is cautious. She's always driving at the appropriate speeds, checking her blind spots, and ensuring that her car is in top condition. Billy, on the other hand, he's a little bit reckless. He speeds, he ignores using the seatbelt, and sometimes he even drinks before he drives. Their choices paint a clear picture. The same exact car can be a safe mode of transportation, or it can even become a dangerous weapon. And it really depends on who is behind the wheel. Tragically, Billy's choices leads him to a fatal car accident, which is a stark reminder of what happens with recklessness. This is drawing a parallel to the recent and deeply saddening events regarding Matthew Perry. And I personally extend my heartfelt condolences to his loved ones during these very trying times. Despite his financial success and fame, Matthew battled some personal demons and shadows, including pain, addiction, anxiety, and depression. Unfortunately, his untimely death in a hot tub alone while using high levels of ketamine is really a reminder of the dangers of the misuse of ketamine. Hey, I'm Dr. Ko at Reset Ketamine in Palm Springs, California, and today I want to talk about the use and misuse of ketamine, as well as some safety precautions. Ketamine, much like the analogy of the car, is a paradox. It can be both safe and unsafe. It can be actually addictive, as well as treating people with substance use disorder. Remember, ketamine was originally developed in the 1960s for use as a general anesthetic. Now we're using it off-label for various mood and pain conditions. It has the ability to cause dissociation. In addition, it has the possible ability to reassociate the mind and spirit, which really underlies the powerful nature of ketamine as a therapeutic tool, but also its harm when it's misused. Now, we know that ketamine has been shown to be just as effective as electroconvulsive therapy for treatment-resistant depression. This was an article recently published in the New England Journal of Medicine. We also know that it can rapidly help with depression, anxiety, PTSD, and some forms of chronic neuropathic pain. Also, we've seen it rapidly reduce suicidal ideation in certain patients. However, please note that it can be misused. Some people can get addicted to it, and there are some possible risks to the kidney and the liver and the bladder. Furthermore, when it is misused, especially in the case of unsupervised home use with the mixing of other sedative medications, as well as if someone has multiple comorbidities, it can become a dangerous substance, and it could potentially cause irreparable harm for someone. When we look at the facts, Matthew Perry had a history of coronary artery disease, COPD, emphysema, smoking history, and he had actually done IV ketamine at clinics for several years. In his memoir, Friends, Lovers, and the Big Terrible Thing, Matthew Perry actually talks about receiving ketamine infusions at a rehab center in Switzerland during the pandemic. And he found that it helped ease pain and help with his depression. It seems like he also continued getting IV ketamine therapy while he was in California. However, for one reason or another, this was one of those days with the perfect storm. He was alone. Very high doses of ketamine, like anesthetic levels of ketamine in his bloodstream, while he was in a jacuzzi portion of the swimming pool. There was no one around him again, and it was mixed with other medications that they found in the toxicology reports, such as benzodiazepines and opioids. Because of this dangerous mix, it ultimately led to his recent passing that now everyone is talking about, and really a hot topic these days. Here's the thing. The key to harnessing the benefits of ketamine therapy lies in the responsible use of it. The FDA actually had a letter released on October 10th, 2023, discussing the dangers of compounded ketamine at home, which really highlights the fine line between what is legal and what is wise. So, going back to this analogy of the two drivers, the way we handle the ketamine really determines its role. It could be really therapeutic or it can be really dangerous. I think the gold standard of ketamine therapy is really with continuous monitoring of vital signs, which ensures the safety and efficacy, as well as having medical professionals inside of the room while the ketamine infusion is happening. It's also crucial to never mix it with other medications, especially in vulnerable settings like a hot tub. And certain conditions may prohibit someone from doing ketamine therapy, coronary artery disease, COPD. These can be quite dangerous when we mix it. So, furthermore, if it's used at home, it really has to be used with a responsible support person immediately nearby with the appropriate dosage, following the exact directions that the doctor or clinician who prescribes the medication, as well as being completely forthright with your physicians about exactly what you're taking and what medical conditions you may have. As we reflect upon these insights, let's remember that every beneficial substance carries the potential for misuse, and wisdom lies in knowing the difference and acting accordingly. Ketamine is like a car, it's a tool, and its impact is determined by how responsibly we use it. So let's navigate this path with care, awareness, and respect for the power that it truly holds.